to our Commissioner Status Update. It's September 12th, 2023. The time is 10 a.m. I'm calling this meeting to order. In attendance are Commissioners Brooks, Matari, and Duncan. Are there any changes to the agenda? Okay, hearing none. We'll start with our PMR Contract Overview and our Alliance.
Good morning, everyone. Good to see you again. Over the past few weeks since our last meeting, we provided a draft of the PMR Healthcare Service Agreement to Council for the county. And part of the exercise there was any red line questions, comments that the county had, then we took that under review on our end. So this morning I was going to provide an overview of just the key components of the agreement and the amendments and changes that were made based on council's feedback,
Okay.
and then field any questions that may come up.
All right, thank you.
Scott, if you would, yep. We refer to this as a service agreement. So in the service agreement, it's speaking to PMR Healthcare providing primary care services that include necessary labs associated with an office visit, any medications that might be available and prescribed as a part of that office visit, occupational health testing services for like drug and alcohol, pre-employment physicals, things of that nature, as well as treating worksite injuries. All are within the scope of the medical team. So it is a service agreement structure outlining the services that we would provide. It's a 3-year term. And the reason for the 3-year term is multifold, but one is as we recruit providers to actually service that location, that could be a provider that might be leaving their private practice to work for you, that might be relocating. So they want to know that any employer that they're serving has made a commitment to them as they make a commitment to you. That's one of the main reasons for a 3-year term, but you will also see that the behavior of your employees that are on your health plan and their dependents, that over months and quarters, they will begin to embrace the clinic as those months and quarters pass as well. So it's allowing, that 3-year term allows all of the above to unfold. There's, as expected, termination language that allows with and without cause. The county has options to terminate with and without cause. There's a cure period. If there is cause, an opportunity for either party to correct that, but there's still some very specific language that allows both parties to terminate with and without cause. There were some of the high-level requests from your council was to include non-appropriation of funds language, so that has been added as an addendum to the agreement. The governing law of the contract was originally Indiana, which is the state that we're domiciled, but that's been changed to Idaho upon request. And they may have other pieces, but I'll keep going unless there's other. There is language in the agreement that down the road, should the county be open to other employers who may approach you about sharing access to the same medical team, there's language in the agreement today that would allow that to occur. Envision if that does happen down the road for various business reasons, it would just have an amendment to this core service agreement that would just define who that party is and what's required of them as a sharer of your clinic. Realizing that it's down the road, something to keep briefly in mind about sharing partners is that if that does not impact the availability of your team members to have access to care, it's incumbent upon PMR to adjust the necessary provider team to make sure that all employees have access as they need it, even if a share comes into the mix. A share of your site also can offset some of your fixed cost as well, so it actually can contribute to the return on such if it makes good business sense to do that down the road. There is a mutual indemnification language in the general provision section of the agreement. Both the county and PMR, there's language to hold each harmless to the extent possible from any wrongdoing by either party in the arrangement. I spoke a little bit on the service agreement and the scope of services. Number one is a very high level, but employees will be opportunities for wellness, their annual physicals, biometric screenings, primary care. This is family medicine, basically, that's being practiced here. Any necessary labs, lab draws, lab processing, lab results to be able to review with patients are done in the clinic. The formulary prescription formulary for the clinic is based upon our review of the data that Alliant provided us as to commonly used generic and brand medications of your members. So we will stock as many of those as possible so that employees with no out-of-pocket would have access to those medications. And then disease management for those who have hypertension, diabetes, Crohn's disease, musculoskeletal issues, is to be able to help them be more compliant with their treatment regimen. B is about the worksite piece, and I don't want to lose sight of that part because many times the opportunities to treat worksite injuries and any of the testing that you might be doing as a county, it's immediate service. We like to think that we help favorably impact OSHA recordable events and that, so it would be incumbent upon us to show you the results of those efforts over time through the reporting. You may recall this is a physician-led clinic, so it ideally would be a physician, nurse, and a medical assistant, so a 3-person team that would be recruited initially from the local market. If qualified candidates don't come forward locally, then we'll continue to expand the reach until we identify candidates. There would be an opportunity for, as we work with your team, to also understand better the culture so that we recruit a provider team for the culture, and a chance for you to meet these individuals as well as part of the process, in the selection process. The clinic location today at 11, actually going to join Sylvia and Scott to actually go look at a site that's appearing to be maybe a good location, both upon where your members reside as well as where they work. And it was a former clinical space, so it could help us from a build-out perspective that hopefully there's only cosmetic changes that need to be made. So that's the lens that we're hoping to review that with today. Importantly, the pricing components, we bill in 3 manners. One, there's a setup cost. That setup cost would include that recruitment of that provider team. It would include the employee education and communication pieces that will go out. It's the medical supplies that will be needed to service all of the members that will be brought in from an inventory perspective. So there's several things that I noted there that go into that one-time setup fee. The monthly fee that we charge, we took your medical data for the last 3-year period of time in pharmacy data, and that data allowed us to identify specifically from a 3-year look back how much of that care could have been done in this setting. And the dollars associated with each of those claim lines is what helped us to identify how much care should we anticipate that we're going to need to provide to your members. And then once we reviewed the data to determine that, the next part of that was what would be the anticipated utilization of your employees. And we were conservative in estimating how many of your employees would access the clinic until they're comfortable with it, and then how many of your dependents would access it. And each month you should anticipate seeing that increase because word of mouth will get out. Employees not having wait times will be a favorable, and when they say, hey, I really had a quality visit and I didn't have to pay anything out of my pocket, all of the above is what will continue to drive that. But all of that led into a monthly program fee as to the provider's time, the care provided, the med supplies, everything is rolled into that monthly fee. And those are services that would not be billed to your third-party payer any longer. So we should see that adjustment on the TPA side of the equation, and then you'd have our monthly bill that would come to us for the care that we're providing. That monthly fee does not change, so the county can literally budget to that month by month. It would not change at that point. The third component of that is the labs and RX services. We have no idea until the patients show up what labs or RX would be needed. But when they are provided, they would be billed, and you will see a line item of every one of those services and charges. It would be de-identified in a HIPAA-compliant manner, so you wouldn't know who it was for privacy reasons. But basically, the cost of those labs and RX services are basically wholesale cost. So generally, we would be showing in our reporting how that is less than what, had those same services gone through your health plan, it would have been here versus what we're billing the county at a lower price point.
And those services are basically being done now. We're just going to be getting them at cost from PMR.
Yeah, so you're shifting, I like to say, shifting the care to a more affordable solution. So you have your general provisions, 3-year term, service agreement providing health care, specific changes as the county requested regarding an appropriation of funds, and the governing state being Idaho. The medical team makeup physician-led, and that's what's all been included in the contract. Our management, CEO, has signed that agreement, and then I think it comes back before you if to sign, hopefully, as we go forward. I feel compelled to tell you thank you for just the opportunity. It's been about a year journey, give or take, maybe a little bit less, but it's a very important decision, and I thank Alliant and Sylvia and Dave and the commissioners for just going through the methodical process.
Sure. Any questions? No? Bruce?
Yes. In the agreement, it says in August we have to sign in order to get the $5,000 a month credit. I take it that's been extended.
And I would like to say yes to that. I need to specifically go and bring that up to because I in reviewing it as well, I saw that there was a specific date on there. I would like to say yes. I just, in all courtesy, just want to go call my CEO and say, hey, can you officially put that in writing real quick, confirming that that's still there.
Yeah, because I think there were some delays that were unanticipated that caused that.
Yeah.
And then the other question is, you have a cap. What was it, 4.75%?
Yes,
75%. What is that based off of, that increase?
Off of the monthly fee that's there.
Okay, but it's not based off of some CPI or anything, and you're just saying the increase each year will be this amount, and it's based upon?
Well, medical inflation at present for us, we are impacted by it as well. So our med supply cost and that will go up. Generally, in all fairness, Commissioner, right now we're experiencing 9 to 11%. So we're looking at the county saying that the most we will do is about half of what we're experiencing. Because this is a great opportunity for us to show, as a large employer, the impact we can have in the community. But we are truly actually accepting about half of what our inflationary costs are for medical care.
Okay.
Another nice thing about that is when we factor the overall budget, we're using a starting point of about 9 to 10% on the overall spend, so that we can cap 4.75 on this component is a pretty good deal.
But other questions or
Anything else?
No, just work on your CEO.
Yeah.
yes.
I'm confident we'll get that done.
Just in all due respect to him, I know he's very committed to this project. So, and I was reviewing the same. I thought, wow, I saw the date on there.
Okay.
Okay.
Just in courtesy, usually every September, our vendor partners modify our agreements. So I think the goal was to try to get this done before any changes in our cost occurred, which is where those August dates came from.
Yeah.
So that's why I just want to go back and say, hey, in the spirit of everything we've done, are we still all there? And answer officially for you.
That'd be great. Thank you.
Yeah.
All right. Thank you.
Thank you.
Sylvie, did you have something to add, or you're good?
Oh, I'm good. I think they provided a good overview, and legal and myself want to make sure you guys have the information you needed. The plan is to bring the contract to next Tuesday's business meeting for signature.
Great. Thank you. All right. Okay. Item number 2 then, impact fees. Thank you all. You don't have to stick around.
Yeah, this is largely just a quick update. I have a little handout here for with commissioners. After the meeting with the mayors, we had Ann Westcott from Galena Consulting just revise some of our impact fees. And so I'd like to just start on the first page where you see 2 boxes. And I highlighted Kootenai County on the left and then the cities on the right. And there's actually 2 different sets of impact fees because the cities did not want to pay the sheriff's office impact fee because they had police departments. And the same thing with Parks and Waterways with that. And they also didn't want to pay for the radios and vehicles. And so the impact fee on the left is for county, unincorporated county development. And that would come out to $1,749, and it would reduce the jail fee by $86 so that we get rid of the radios and any other equipment that is perceived not to last 10 years or longer. And then with the waterways, that fee was reduced $38. And again, because it's pro rata, it does not include the city populations. And then the right box is the impact fee for those cities that have their police departments. It removes the sheriff's fee. The jail fee is the same. And then Parks and Waterways needs to actually, I think, be removed on that, because that was one of the things was we agreed that we would not seek a park and waterway impact fee for city residents that had that. And so those were the adjustments, and assuming that the board is good with that, and I'll get final confirmation on the Parks and Waterways under the city box, then I would like to take that to the mayors and hopefully get their blessing.
Sure.
And-
Thoughts?
Oh, I'm sorry, just the second page is what the old report was with the old structure. So,
Nice job, thank you.
All right, any thoughts, questions on that, Bill?
No,
Okay. Yeah, I'm happy to move ahead with the changes that the mayors had suggested. And
Yeah, I think it's the most expedient way
Yep.
to move forward and get this thing going.
yeah, over the last 4 years, I think we've missed out on, I don't know, David, 1,200, 1,600, so probably 2,000 homes. Last.
At least.
Yeah.
Yeah, so, okay.
All right, so
That's
so this is the meeting that they're coming back in October?
Yes, so we were going to talk about the impact fees and the adjustments that the board has made
Okay.
for that. And then also, I'd like to just kind of open it up too for a biannual meeting with them, that we can just start engaging with them and having dialogue. And we can share each other's challenges.
Yep, sounds good. All right, anything else on impact fees?
That is it. Thank you.
Okay, great. Item 3, Skeet Club update. Dave had given us, I don't know if you call it a rubric or just a chart, regarding where he's at with Idaho Department of Fish and Game. And I think with your meeting.
Commissioner, that chart wasn't something I created. That was
Oh.
Kathleen Tever that created that.
Okay,
If you recall, I provided an email to the board about a month ago, I guess, after my meeting with her, with sort of the concerns that she had, sort of a
Yeah.
list. That was my email. This chart is her follow-up to our meeting.
okay,
So,
So-
just so you're clear, I didn't create that.
sure.
Yeah.
So I would like to give this chart to, to release it to Gaston and have Gaston and Dave discuss some of these issues, because I think after the FAA meeting last month, Gaston has some really good path forward on this project. So,
Yeah, absolutely.
so is that good? Okay, so that's really all I have, because some of the stuff in here, is, I made my own notes, but since the FAA meeting, some things have changed. So I think it'd be good to update Dave, and then Dave can update Kathleen, and we can continue forward with this project. So,
And we don't need any motions for any of these. Or-
no, the impact fees was the only thing, if we wanted to agree to not charge the Parks and Waterways, if we wanted to make that official motion, but we haven't even got to the public hearing. So to me, it's administrative at this point, Dave, if you agree. Yeah,
okay.
so that's all. But yeah, so the Skeet Club is not, we're making no decisions today. We're just asking that, Gaston work with Dave and get some of these issues with Kathleen
Okay.
done.
Perfect.
So, okay, anything else on that? Bill, nothing? Okay. All right, now we have 2 executive sessions to go into, and we'll just go in once and handle both and then come back out. So, Dave, I think you're definitely staying for one portion of it, and Ben will stay, but I think that's,
I move that we enter into executive session pursuant to Idaho Code 74-2061B and 1F.
I second the motion.
Bill
All right, it is 11:32. Is there a motion?
Yes, I move that we exit executive session 1F with funding to proceed as discussed and 1B with staff to proceed as discussed.
I second the motion.
Bill Brooks,
Aye.
Commissioner Matari.
Aye.
Chair Duncan.
Aye. All right, public comment. There is nobody here. 11:33, meeting adjourned. Thank you.